Okay, so now let's focus on how to approach test questions. First thing is you have to be methodical and you have to read carefully. All right. I know that sounds super simple, but really what that means, and this is one of the most important things that you want to practice, is slowing down. Don't try to rush through the question. Again, if you're having anxiety and it's making you feel like you need to rush, I want you to pause, take a few relaxing breaths, and come back to the questions. So often students miss answers because they read too quickly and they just didn't pick up on those key words. So I don't want you to dart around looking for a familiar answer. I want you to really slow down, be methodical, and read carefully. Let's practice on a question. So in this question, let me read the stem to you. A laparotomy is scheduled for a client who is admitted to the hospital for a ruptured ectopic pregnancy. Preoperatively, which goal is most important for the nurse to include in the plan of care? In this stem, important cues are laparotomy, ruptured ectopic pregnancy, and pre-op goal. So I know before looking at the answer choices that I am looking for the most important goal for a client with a ruptured ectopic pregnancy. Now I can look at so that's all in my stem. Now I can look at my answer choices, and I'm not trying to grab an answer right now. I'm just reading through the 4 answer choices. I have fluid replacement, pain relief, emotional support, and respiratory therapy. At Kaplan, we use our decision tree to help critically think through every question. So now to further understand my topic, I need to think like a nurse. What content connection can I make about a client with a ruptured ectopic pregnancy? All right, what are you thinking? I'm thinking that they are likely hemorrhaging. So we're looking for the most important pre-op goal for a client who is hemorrhaging. I need to reflect on this content connection as I review the answers. And remember, the answer needs to match the topic of hemorrhage. So that's why understanding your topic and slowing down with that stem is so important, because your answer has to match that topic. And if you don't slow down and get that topic correct, you're not likely going to get the credited answer. All right, so now we're going to go ahead and we're going to look at these answers and we're going to reflect on our topic. So fluid replacement, would this be important in a client who is hemorrhaging? Absolutely, right? We need to get some fluid into that client to counteract the blood loss. So I like fluid replacement. I'm going to hold on to it. Number 2, will my client have pain? Yes, they are going to have pain. So now I have to ask myself, will managing this pain take priority over managing the hemorrhage? Nope. All right, we can eliminate it. We need to manage that hemorrhage. Number 3, emotional support. Will my client need emotional support? Yes. Will emotional support prevent my client from hemorrhaging? No. All right, we need to prioritize that hemorrhaging, so we will eliminate number 3. Number 4, respiratory therapy. This is an attractive answer for many students. So we need to ask ourselves, will my client need respiratory therapy? Maybe, but here's what I want you to ask yourself. What do they mean by respiratory therapy? Are they talking about a nasal cannula, a face mask, chest PT, postural drainage? What do they mean by respiratory therapy? That is a really vague answer, and I want you to beware of vague answers on the NCLEX. If it's not really telling you what you're going to do, it's probably not going to be the credited answer. So, and again, respiratory therapy will not prevent my client from hemorrhaging, so we can eliminate it. So which answer matches my topic? Yep, you're right. Fluid replacement matches my topic. We have a circulation topic and we need a circulation answer. All of the answers are actions we would consider in a client with a ruptured ectopic pregnancy, but I know this client is hemorrhaging and the answer that matches the topic is fluid replacement. This promotes safety. That is going to be our credited answer. Okay, let's do another question here. We're going to start with the stem. After 2 weeks of receiving lithium therapy, a client diagnosed with mania becomes depressed. Which action is most important for the nurse to implement? So it's asking us to prioritize an action for a client on lithium therapy. That's our topic. Now we need to think like a nurse and we need to reflect on what do we know about lithium. It is a mood stabilizer and it can take up to 1 month to be effective. Does it appear to you that the client's mood is stabilized? No. So we need to consider that as we review the answer options. Number 1, monitor the client for suicidal behavior. All right, this is a right here, right now answer that promotes safety. So I like it. I'm going to hold on to that answer. But let's look at number 2. Continue the current treatment plan. Is our client completely stable? We have no concerns. No, we need to do something for this client, right? So this is what we call a do nothing answer. Let's eliminate it. Number 3, explore with the client the reasons the client appears depressed. This may be helpful, but will it be right here, right now, promoting safety? If we sit down to explore, will everything magically become okay right now? Okay, not likely, correct? So therefore, it's not a right here, right now. We have a better answer that promotes safety right here, right now. Let's eliminate number 3. Number 4, contact the healthcare provider to discuss the addition of an antidepressant. We need to ask ourselves, is the medication likely in the therapeutic range already? No, it probably isn't. So we need to promote safety first. We will eliminate number 4. We don't want to add another med before we get the current med in therapeutic range. Number 1, promote safety. So remember, you always need to make sure we answered the topic because this is another area that you may find that you make mistakes. You started going down one path and you were going down the wrong path. So really the safeguard here is to always stop at the end, take a pause. I always tell students it's kind of like taking the surgical pause that they take in the OR. Take a pause, and then I want you to make sure, did you answer the topic? Will monitoring the client for suicidal behavior be a priority action for a client on lithium with depression? Yes, absolutely. Number 1 is our credited answer. Okay, let's do this last question. We're going to start with the STEM. The charge nurse assigns care for several newborns in the nursery. They were all born within the last 2 hours. Which newborn requires immediate follow-up assessment by the nurse? And it's a select all that apply. So remember, we can have 1, several, or all credited answer. So it's asking us to determine which newborns require immediate assessment. That's our topic. Now we need to think like a nurse and reflect on what we know about normal findings in a 2-hour-old newborn. By having this knowledge, we will be able to determine which newborns have something abnormal occurring and therefore they need immediate attention. All right, so let's look at number 1. The newborn who straightens their arms and legs outward and flexes their knees when the bassinet is bumped. This newborn is stable. This represents the Moro or startle reflex, and so we can eliminate it. That newborn is not having or showing any abnormal findings. Number 2, the newborn with acrocyanosis and a delivery heart rate of 130 beats per minute. This newborn is stable. Acrocyanosis is that bluish discoloration in their hands and feet that may be present in healthy newborns. It does not represent central cyanosis, and it's normal to see in the first 12 to 24 hours. The normal range for a newborn heart rate is 120 to 160 beats per minute after birth. So again, nothing abnormal there. We can eliminate it. Number 3, the newborn with a brachial artery blood pressure of 50 over 30 millimeters of mercury. This newborn is unstable. That blood pressure should be more like 80 over 45 to 60 over 40. And so this blood pressure represents a low blood pressure and may be related in some format to a circulation problem in this baby. So again, we are concerned here. This is abnormal. We need to reassess this baby. So we are going to hold on to that answer. Number 4, the newborn with a high-pitched, shrill cry. This newborn is unstable. The cry should be loud and strong. A shrill cry may indicate neurologic disorders or hypoglycemia. So that baby needs reassessment. Let's hold on to it. Number 5, the newborn whose thorax expands and contracts with respirations. This newborn is unstable. And why do we say that? Students often get stuck on this answer. Remember that newborns should be belly breathers, right? And this baby is using their thoracic muscles to breathe. So that tells you that they have some type of respiratory distress going on. That baby needs to be reassessed. Let's hold on to it. Number 6, the newborn with fine crackles and a respiratory rate of 45 breaths per minute. This newborn is stable. The crackles are sounds in the lungs when fluid is present in the bronchi, and this is expected with a newborn client. The normal respirations are 30 to 60 breaths per minute. This baby does not have any abnormal findings. It does not need to be reassessed right now. We can eliminate it. So now you always want to make sure, did you answer the topic here, right? Did you answer it the right way? So I always ask myself, do newborns in 3, 4, and 5 represent babies that we need to immediately reassess? Yes, those are our credited answers.